When a femoral fracture occurs, every screw, nail, and angle matters. Among the tools at a surgeon's disposal, the PFNA1, PFNA2, and gamma nail stand out. But what truly separates them? And why does it matter even beyond the OR? Welcome to Ortho Implants for Life, your one-stop destination to get all orthopedic industry-related information. Simply, clearly, and visually. If you're a student, healthcare professional, or just curious about how modern implants work, you're in the right place. Today we will discuss PFNA1 versus PFNA2 versus gamma nail. Which intramedullary nail does what? Disclaimer. This video is intended for educational purposes only and does not provide medical advice or prescribe specific treatment choices. Always consult appropriate clinical guidelines and experts before making any surgical decisions. Setting the stage, intramedullary nailing unveiled. Intramedullary nailing has revolutionized the way we manage fractures, especially those of the proximal femur. By working within the medullary canal, it offers a minimally invasive yet biomechanically stable solution. Over the years, we've moved from basic straight nails to anatomically contoured locking designs. Among these, PFNA1, PFNA2, and the gamma nail have emerged as widely adopted options, each with its own design philosophy and clinical application. PFNA1, the foundation and its strengths. PFNA1, or proximal femoral nail, anti-rotation, was designed to address unstable trochanteric and subtrochanteric fractures. The standout feature? Its helical blade, which compacts cancellous bone rather than carving it out, providing rotational stability and reduced cutout risk, especially in osteoporotic patients. Its medial lateral angle of 6 degrees matches the femur's natural anatomy, reducing stress on the bone implant interface. In practice, PFNA1 has shown excellent outcomes in elderly patients with intertrochanteric fractures. However, its limited screw orientation and lack of modularity pose challenges in complex fracture patterns. PFNA2, evolution and enhanced performance. PFNA2 was more than a minor upgrade. It was a thoughtful redesign. While it retains the helical blade concept, PFNA2 introduces a longer nail option, reduced mediolateral angle, and oblique lateral aperture, making it suitable for Asian femoral morphology and varied fracture patterns. It also features improved instrumentation and better anatomical fit, reducing the chance of implant-related thigh pain and secondary complications. These upgrades allow PFNA2 to extend its utility to more distal fractures and more complex presentations. Gamma nail, a legacy of stability. Enter the gamma nail, a staple in trauma surgery since the 1980s. Originally designed by Medica, it was one of the first intramedullary nails with a sliding hip screw mechanism. The gamma nail excels in stable and unstable intertrochanteric fractures, offering a lag screw mechanism that allows controlled collapse at the fracture site. What makes it unique is its high torsional stability and ability to handle high axial loads. It remains widely used due to its robust performance, even though newer nails like PFNA have introduced refinements. Making the right choice. Practical considerations. So, how do these systems compare head-to-head? PFN. A1. Great for osteoporotic elderly patients with stable to mildly unstable fractures. Strong rotational control. PFNA2. Versatile. Improved fit across populations, better suited for complex or more distal fractures. Gamma nail. Proven legacy system, excellent for high-stress fractures, but with slightly more bone loss during insertion. The right choice often depends on fracture morphology, patient age, bone quality, and surgeon experience, not just brand or preference. The road ahead. Future of intramedullary nailing. So what's next? Expect smart implants, robotic-assisted placements, and personalized nailing systems designed from patient-specific imaging. Still, the foundational principles behind PFNA1, PFNA2, and Gamma Nail will continue to guide innovation. Each of these systems tells a story of biomechanical problem solving, and each has a rightful place in orthopedic practice. By understanding their evolution and application, we step closer to tailored, precision-based fracture care.
If you have enjoyed the video, like it, share it, and if you are new to our channel, subscribe it. Hit the bell icon to get notifications for all our upcoming videos. Join us to excel in this orthopedic implant industry and to know more about the job and career growth which is available in this industry. Thank you. See you again next week.